Ever wondered what labor pain feels like? Well, you're about to embark on a journey of discovery with us as we unravel the mystery of labor pain. Now, before you get anxious, remember that every woman's experience with childbirth is unique. The intensity of labor pain varies from one person to another, and it's influenced by a multitude of factors. Firstly, there are physical factors at play. The size and position of the baby, the strength of uterine contractions, and even the mother's overall health and fitness level can all contribute to the intensity of labor pain. But it's not all about the physical aspects. Emotional factors also have a crucial role in shaping this experience. Personal fears, stress levels, and even the level of support one receives during labor can significantly impact how one perceives and manages the pain. Labor pain is often described as an intense, cramping sensation that starts in the lower back and spreads to the abdomen. Some women compare it to severe menstrual cramps, while others liken it to intense waves that come and go in rhythm with the contractions. However, these descriptions are just generalizations. No two women experience labor pain the same way, just as no two pregnancies are alike. It's also important to note that labor pain isn't merely a physical sensation. It's an integral part of the childbirth process, signaling that your body is working hard to bring a new life into the world. The pain of labor, as intense as it may be, is a sign of the amazing strength and resilience of the female body. The mystery of labor pain may seem overwhelming, especially for first-time mothers, but understanding the factors that contribute to it, as well as the various ways it can be managed, can help demystify the process. Knowledge is power, and the more you know, the better prepared you'll be for the journey ahead. As we delve deeper, you'll discover the science behind labor pain, making it less of a mystery. So stay with us as we continue to explore this fascinating topic. So what exactly causes labor pain? Let's delve into the physiological aspects. The primary cause of labor pain is uterine contractions. During labor, the muscles of the uterus contract and relax to help push the baby through the birth canal. These contractions can be intense and frequent, leading to a sensation of cramping or pressure in the abdomen and lower back. Next, we have cervix dilation. As labor progresses, the cervix, which is the lower part of the uterus, begins to dilate or open up to allow the baby to pass through. This dilation can cause a sensation of intense pressure or discomfort, akin to severe menstrual cramps. Adding to the mix is the pressure on the pelvis. As the baby moves down into the birth canal, it puts pressure on the pelvic bones and tissues. This can lead to a feeling of fullness or heaviness in the pelvic area, which can be quite uncomfortable. Now let's talk about hormones. Oxytocin, often dubbed the love hormone, plays a crucial role in labor. It triggers the uterine contractions that help push the baby out. But here's the kicker: oxytocin is also involved in pain perception. Higher levels of oxytocin can enhance the sensitivity to pain, making labor contractions feel even more intense. On the flip side, we have endorphins, the body's natural painkillers. During labor, the body releases endorphins to help cope with the pain. These hormones can create a sense of euphoria and help to ease the discomfort of labor. So there you have it, the science behind labor pain. It's a complex interplay of muscles, hormones, and nerves, all working together to bring a new life into the world. Understanding the science of labor pain can help demystify the experience. But how can you manage this pain? History is rich with techniques to manage labor pain. Want to know some? Let's dive in. Traditional pain management techniques have been tried and tested for generations, and many remain effective to this day. One such technique is deep breathing. By focusing on the breath, you can help your body to relax and create a rhythm that works in sync with your contractions. Deep breathing can be as simple as inhaling deeply, holding the breath for a few seconds, and then exhaling slowly. Another technique is meditation. By finding a quiet space within your mind, you can help to ease the stress and tension that comes with labor. Meditation doesn't necessarily mean sitting cross-legged and chanting. It can simply involve visualizing a peaceful place or situation, helping you to stay calm and focused during contractions. Massage, too, can be a powerful tool in managing labor pain. A gentle rub on the back, shoulders, or feet can help to alleviate discomfort and promote relaxation. Remember, the aim of a massage during labor is not to knead out knots, but to provide a comforting and soothing touch. Now let's talk about the role of a supportive partner or doula in labor. A doula is a trained professional who provides emotional, physical, and informational support during childbirth. They can guide you through these traditional techniques, provide reassurance, and help create a calm and supportive environment. Partners, too, can play a crucial role in pain management. Just their presence can be comforting. They can assist with techniques like deep breathing, offer words of encouragement, and provide hands-on support, like massage. It's important to remember that everyone's experience with labor is unique. What works for one person might not work for another. However, these traditional techniques have stood the test of time and can provide a natural and holistic approach to managing labor pain. While these methods have been used for centuries, modern medicine offers additional options. Modern medicine has brought a range of options to manage labor pain. So let's delve into some of these contemporary methods. One of the most common techniques utilized today is the epidural. This involves placing a small tube in the lower back, through which pain-relieving medication can be administered. The beauty of an epidural is that it dulls the pain significantly while allowing the mother to remain alert and active in the birthing process. However, it's worth noting that epidurals can sometimes slow down labor and may require additional interventions like forceps or vacuum-assisted birth. Another modern technique is the spinal block, often used for cesarean sections or when an epidural isn't effective. This is a one-time injection into the spinal fluid, providing rapid, potent pain relief. The upside? It works quickly. The downside? Its duration is relatively short, typically under 2 hours, and it can cause a drop in blood pressure, so careful monitoring is necessary. Next up, we have nitrous oxide, or as some know it, laughing gas. This is a mix of nitrous oxide and oxygen that you breathe in through a mask. It doesn't eliminate pain, but it can help reduce anxiety and make the pain less intense. It's self-administered, meaning you have control over when and how much you use. Potential side effects include nausea, dizziness, and a sense of disorientation. Lastly, let's not forget about patient-controlled analgesia. This is a method where the mother can self-administer a dose of pain medication through an intravenous line. It gives the mother a sense of control and can be adjusted to suit her unique pain level. However, it can lead to oversedation if not properly managed. These are just a few examples of modern pain management techniques. Each has its benefits and potential side effects. It's important to remember that what works best will depend on the individual, their health, and their personal preferences. With a myriad of options available, it's essential to make informed decisions. And remember, your healthcare provider is there to guide you through this process, ensuring that you have the safest, most comfortable birthing experience possible. If you found this video helpful, please like, share, and subscribe for more informative content. So, how should you choose the best pain management option for you? Well, it all starts with understanding your options. Let's dive right in. When it comes to labor pain management, there is a plethora of choices. From traditional techniques like breathing and relaxation exercises to modern methods like epidurals and spinal blocks, the options are as diverse as they are effective. But remember, every birth is unique, and what works for one person may not be the best fit for another. The next step is to consider your pain tolerance. It's essential to be honest with yourself about how you handle pain. If you know you have a low pain threshold, it may be wise to lean towards options that offer more significant relief. However, if you feel you handle pain well, you might consider less invasive techniques. This isn't a test of bravery. It's about making the experience as manageable as possible for you. Now, while understanding your options and considering your pain tolerance is vital, nothing beats open communication with your healthcare provider. They are there to guide and support you, armed with years of experience and professional knowledge. Don't hesitate to ask questions, share your fears, or voice your preferences. After all, this is your journey, and you should feel empowered to navigate it in a way that feels right for you. It's important to remember that there is no right or wrong choice when it comes to managing labor pain. The best choice is the one that aligns with your comfort, beliefs, and medical condition. Whether you opt for a med-free birth or choose to utilize modern medicine's full power, your decision is valid and should be respected. Remember, knowledge is power. Understanding labor pain and your options can help you make the best decision for your unique journey to motherhood. Here's to you, and here's to a birth experience that's as beautiful and unique as you are.